Hi everyone, this is Alexander Lim and welcome to AuthorStory, where on every episode we speak to a different author on a particular topic of interest. On today's episode is Dr. Stephen Curley, who is a surgical oncologist and cancer researcher who has been leading a basic sciences laboratory for 22 years. His book is In My Hands: Compelling Stories from a Surgeon and His Patients Fighting Cancer, and you can check it out right now by clicking on the Amazon link in the video description below. So, Stephen, welcome. Great to have you with us on Author Story.
Well, Alex, a pleasure, and thank you for having me.
You're welcome. So, Stephen, what made you decide to write In My Hands?
Actually, my patients, they
Okay.
encouraged me to write this book. These are stories about patients that
Mhm.
I would oftentimes share with new patients who had been recently diagnosed with cancer. And of course, we're facing the fear and uncertainty that goes with such a diagnosis. And so I would tell these stories either to reassure or encourage them, or sometimes just to let them know that there were other people who had gone through similar experiences and something that hopefully they could identify with.
Right. But did you have any idea, when you're telling these stories and all this, that you would be writing a book on it?
No, I really didn't. I've always been a note taker throughout my life and career. If I saw something interesting or heard an interesting story, I would write it down.
Right.
I have all kinds of notes and notebooks scattered all over the place.
Right.
And so I would remember these stories and, of course, would then use them to illustrate points with patients.
Mm.
And as I said, over the years, my patients found them to be very helpful and encouraged me to write them down. So I finally got around to doing it.
Okay, okay. So it's not like there was a single aha moment then. You know what I mean? It's sort of like a building up kind of thing.
That's exactly right.
All right, cool. So, Stephen, let's get on to brass tacks and the basics. I mean, like, cancer is a big issue nowadays, and it's known to be a potential lethal disease. Well, it is a lethal disease, particularly some variants. But how big is the problem? As in, like, how many people have or will get cancer?
Well, this is a statistic that's quite sobering. It's currently estimated that 38% of Americans will be diagnosed with cancer sometime during their life.
Wow.
So that's slightly greater than 1 in 3.
Right.
So that means even if any given individual isn't diagnosed with cancer, they will certainly know people who are diagnosed with cancer. It may be a spouse,
Right.
a parent, a child, a coworker, a colleague, somebody.
Mhm.
So it is something that is going to impact everybody's life.
Right, right. And of course, I mean, geez, it is a serious illness. I mean, as I mentioned before, like some versions are particularly, it's hard to survive those things.
Very true. I mean, with some cancers, we've made remarkable progress. Some of the leukemias, some of the lymphomas,
Mhm.
we're doing much better with breast cancer and colorectal cancer than we were 20 years ago.
Mhm.
Conversely, with some tumors like pancreatic cancer
Right,
and liver cancer, we haven't moved the needle much at all.
right,
And the majority of patients diagnosed with those diseases still die as a result of them. So
right.
there's still a dramatic need for more research, better treatments, better understanding of how to diagnose and really, hopefully, ultimately learn how to prevent these diseases.
Right, right. Okay. So, it's not often that we ordinary folks, so to speak, get a glimpse of, what it's like to be on the front lines, fighting cancer, much less someone who's involved as you are. So, for the benefit of those of us who aren't familiar with medical practitioners like yourself, what is it like to be treating patients, particularly like when you're in the operating room, something like that, and really working on them?
Well, as a surgical oncologist, yeah, frankly, I've got a little bit of an advantage over some of my medical colleagues, say medical oncologists or radiation oncologists. There are still some patients with certain early stage cancers who we can potentially cure with an operation.
Hmm.
Say removing a small breast cancer or
Right.
removing an early stage colon cancer.
Mm.
So that's always very gratifying. And even in patients with some of the more difficult diseases or more advanced disease,
Mm.
there are a proportion who will survive long term if we can surgically remove their tumors.
Hmm.
So that's always the hope with every patient is it's going to be one of those long-term success stories.
Right.
Now, the reality is we can never predict that exactly.
Right.
We have to hope that our patients will succeed, but we follow them. And that's one of the unique things about a practice in surgical oncology. It's not like, say, you went to a surgeon because you had a bad gallbladder and they took it out and they saw you once in the office afterwards. And then it's like, okay, get on with your life, and you never see that individual again.
Right.
With me, I follow my patients for life because I know
Right.
their cancer can recur.
Mhm.
I know it may come back, and I want to jump on it early if it does.
Right. Okay, so this is then we're really talking about relationships here. It's not just your typical, as you mentioned, the doctor, one treatment, that's it, follow up, and that's it. It's like you really do follow these people over the period of several years.
Absolutely. I've got patients who I've been seeing for 20 years now.
Wow.
I've got some who, were told 20 years ago they had 6 to 12 months to live who are still
Right.
around.
Okay.
So those are the kinds of stories that obviously energize and encourage me and my colleagues. And it also is a poignant reminder that it's not everybody. There are
Right.
some patients who, maybe had a similar situation and they didn't survive more than a few years. And we
Right.
would love to understand the differences in those groups and how we can, swing a greater population of patients into that positive long-term outcome group.
Right. Right. Okay. Yeah. I mean, yeah, that's definitely the goal. Get everyone well if possible.
Right.
All right. So, I don't mean to be too much of a downer, Stephen, but I mean, we are talking about cancer and cancer patients here. What's it like, if you don't mind my asking, traveling a road, so to speak, where you know that not all of your patients will make it?
Uh, well, the best example I can give is the roller coaster ride. It's got lots of ups and downs. There are days where, I may have seen numerous patients in clinic, and there may be several long-term survivors and people who are recovering well from a recent operation, and everybody's doing great. And
Right.
then I may have a clinic the next week where I have to tell 4 or 5 patients their cancer is back, and it's a
Right.
tough situation. And,
Right.
all the best we can hope to do is slow it down, but ultimately it's going to, cause them to lose the battle against cancer.
Right.
And those are rough days.
Right.
It's physically and emotionally draining.
Yeah.
And so, as a practitioner, it's incumbent on all of us to have a hopefully healthy way of dealing with that angst and emotional drain on us.
Yeah.
For me, it's exercise, whether it be going to the gym or running, cycling, something. I've always found exercise to be a great way to burn off that sort of negative energy that can
Right.
definitely build up when you have to drop bad news on somebody.
Yeah. Right. I mean, yeah. I mean that is a consideration. I mean, yeah. Not many people are involved in their day-to-day jobs where they deal with mortality.
Yeah, and I think one of the things that I learned early in my life is many patients recognize that they may not survive their cancer,
Mhm.
but one of the things that they fear most is that, as they get near end of life issues, is there going to be somebody there to help them if they're in pain or having symptoms, not feeling well.
Right.
And so that's one of the things that's, you know, even if I have a patient who I know is dying from their malignant disease,
Mhm.
if I can help them in some way to control their symptoms or to feel better or provide some nutritional supplements, anything, I know that's appreciated by both them and their family.
Right.
And so people don't want to be abandoned. They want to know
Yeah.
that somebody's going to be there to help when they're having problems.
Right, right. Yes. I mean, the fear of loneliness, I guess, being alone in a very frightening situation, I guess that weighs heavily on their minds.
Exactly.
Right. So, Stephen, can you tell us a little bit? And I know you're working on, you've got a laboratory, or you're working in a laboratory. Can you tell us a little bit about what you're presently working on?
Well, I've always been interested in finding new treatments for patients. So I'm a very device oriented, direct treatment kind of guy.
Hmm.
So I've been involved in the past, for example, in producing devices that types of needles you can put into tumors that kill tumors by heating them,
Right.
something called radiofrequency ablation and microwave ablation.
Hmm.
We're currently doing work with some new devices for non-invasive treatment of tumors with electromagnetic fields.
Mm-hmm.
But we're interested in a number of other things, improving the response to chemotherapy drugs or immunotherapy drugs
Right.
using electromagnetic fields. And we have some very good work in animals that suggests that that might help.
Mm-hmm.
So some of it is taking known therapies that are currently on the market
Mm-hmm.
and improving the efficacy of those. And the other thing that I'm really interested in doing is trying to reduce the side effects of some of these treatments.
Yeah.
If we could use lower doses of some of these drugs but produce an even better effect, that would be a great thing.
Yeah.
Because there are some patients who are technically success stories. They may have survived long term after their cancer,
Mm-hmm.
but they've paid a price for it. Side effects from the surgery
Right.
or from the chemotherapy drugs or the
Right.
radiation
Right.
that can affect their quality of life. So that's an
Yeah.
important consideration as well.
Yeah. Yeah. Yeah, it's not just about treatment, it's about eventually the long-term well-being and how well a patient can actually live life after successful treatments.
Absolutely correct. I've got a example I mentioned in the book of a patient who had colon cancer that had metastasized to his liver.
Mm-hmm.
I was able to do an operation to remove that. He then got chemotherapy afterwards. He's now survived well over 10 years,
Mm-hmm.
but he's not a happy man. One of the chemotherapy drugs he received as a common side effect causes loss of sensation in your hands and feet.
Mm.
And this man was a first chair violist for a major symphony orchestra,
Oh,
and he now can no longer play the viola because he can't feel the strings.
yeah,
So that, yes, he's survived his cancer, but at a considerable cost to, his professional and personal life.
yeah. That's a big impact on someone like him.
Right.
Yeah. So, if I may ask, Stephen, what led you to doing and leading research into cancer treatment?
Well, frustration, really.
Okay, okay.
It was seeing patients who, you know, um, had tumors in a location I couldn't remove
Mm-hmm.
because where they were. So I always wanted to find ways to attack tumors that just happened to be in an unfortunate location, or perhaps there were too many to remove. So I became interested in developing new treatments or ways to try and shrink or destroy tumors. So it was really driven by the patients I couldn't help as a surgeon. They would be sent to me and I would look at their scans and I'd go, gosh, this tumor's in a location I can't really remove it because it damaged normal tissue or normal
Right,
structures, and so I can't help you. And I thought, but gee, if we had a way of destroying that tumor, that would be great.
right.
So that's what really pushed me to start looking at novel treatments.
Okay, and these treatments you mentioned are all like RF, electrotherapy, and all that, and all those kinds of treatments.
Correct.
Right. Okay. Okay. So, let's talk a little bit about the book. I mean, what are some of your favorite stories about your patients?
Well, the book is a very accurate portrayal of life as a surgical oncologist or as a cancer care provider.
Right.
Not all of the chapters are upbeat. Not all
Yep.
of the patients survive.
Right.
Some of my favorite stories involve patients who just show remarkable resilience and tenacity despite dealing with a tough diagnosis, ultimately which may have cost them their life.
Hmm.
Some of the favorite stories, and it was interesting when the book was being edited. I actually got a call from one of the editors saying, this is a remarkable book. She said, one chapter I was crying and the next chapter I was laughing. And she said, I really didn't expect to read a book about cancer that made me laugh, but I do tell some stories in there that are really quite humorous. Patients who, you know, have funny things happen to them or do things that are really humorous and or use humor to buoy up their own spirits and those around them. And I think that's a powerful medicine. There's no blood test for a positive attitude or an upbeat approach.
All
And I've
right.
certainly seen patients who, based on statistical data, you think, well, gee, this person probably is only going to live 2 or 3 years, but
Right.
they went on to live 8 or 9 years. They never beat their cancer, but they didn't give into it. They kept battling, they kept fighting. And those are compelling to me. The fact that, somebody is not a statistic. Each patient, we can't predict exactly how long they live,
Right.
but there are definitely folks who beat the odds and live much longer than we would have predicted based just on their initial presentation.
Okay. Okay. Got that. So, what about lessons learned, Stephen? What are some of the biggest lessons you learned from your patients?
Uh, One, and this is the topic of the first chapter, is to provide hope to patients. And hope doesn't necessarily mean hope for a cure, but just hope that you'll be engaged in the journey with them and
Uh-huh.
that you'll help them in any way you can. You'll refer them to other physicians who can provide assistance.
Right.
One of the lessons I've learned is the importance of just being very direct and straightforward to people, being available,
Right.
not providing information that is difficult to understand, but really spending the time necessary to explain things to people's satisfaction.
Mm-hmm.
And some people want to know a lot, and other people, it sort of surprises me. One of the chapters I wrote about is how amazed I am that I can walk into a new patient's room who's going to need a really big operation,
Right.
and within 5 minutes, it's like, okay, sign me up. I'm ready to go.
Mm-hmm.
And it always sort of stuns me. It's like, wait a minute here. We're talking about a big deal. I need to give you some more information. No, don't want to hear it. Go
Mm-hmm.
for it, doc.
Okay.
And it's like, it amazes me. It's, I use the example in that chapter that, if you're going to go out and buy a new car, you're going to research it, you're going to drive some, you're going to take a little time making that decision.
Right.
But I've learned that some people just say, I have cancer, I want it out of me, do
Right.
whatever you need to do, I'm ready. So
Uh-huh.
those are all important lessons to me. It made me realize that somebody facing a potentially life-threatening condition is very trusting, and that we need as clinicians to respect and honor that trust that people put in us.
Mm-hmm. Right. Okay. Well, definitely. I mean, the trust has to be there. I mean, for a patient to entrust, well, he or she is literally entrusting their lives to you.
That's exactly right, and that is a huge honor and a huge obligation, and one which we must respect and really let the patient know that we're fully engaged in doing all we can for them.
Mm, right. Okay. Stephen, I'm surprised. This, as you mentioned before, this can be a draining profession, and I'm surprised that you still have a great deal of empathy for your patients. And is this common among surgeons? I have to ask, is this common among surgeons, or do some become distant to protect themselves?
Oh, I've certainly seen that mechanism. I mentioned that for me, exercise. For many years I coached soccer teams, and I'd get out and run with the kids, and that would help. Or I still exercise now. Sadly, I have seen colleagues choose less healthy mechanisms of dealing with the difficult situations we deal with. That may be becoming withdrawn or very emotionally distant from their patients.
Right.
I'm sorry to say I've seen some fall into substance abuse
Hmm.
as a mechanism of dealing with it, and that
Right.
ultimately was obviously not a healthy choice.
Right.
So those things do happen. We don't like to see it happen to a colleague, but
Right.
I have to admit I have seen people go those directions, and that is never a desirable thing. But it's important to recognize that burnout is a very real problem faced by, not just cancer physicians, physicians dealing with any type of chronic or potentially life-threatening diseases.
Right.
Certainly people who are dealing with patients with neurodegenerative diseases, things like multiple sclerosis or ALS, things of that nature. Those are tough patients as well, and the emotional fee that we pay for that is big, and we need to find healthy ways to deal with that angst and emotional pain that we feel.
Right. Right. And I mean, from what you've told me just in this interview, it occurs to me that being a surgeon oncologist it's really a calling. I mean, it occurs to me that you're either cut out for this or you're not.
Yeah, it does require a mindset that you're willing to follow patients for a long time. You're recognizing that you're going to be interacting with patients over a long period of time. Uh, some of my fellows used to joke that I was a combination of a surgeon and a family practitioner. Because a patient once came in and said I can't hear well, and I looked in his ear and he had a big wax plug, so I washed the plug out for him, and the
Okay.
fellows teased me mercilessly. They said, "What surgeon would do that?"
Right.
And I said, "Well, he had a problem. I fixed it, so there you go." So
Right.
those are kind of wacky things that happen to us in our jobs that we sometimes get involved in, and patients will inquire about things totally unrelated to their cancer.
Right.
And so it makes for an interesting lifestyle.
I can imagine. So if I may ask, what is the wackiest thing that ever occurred to you?
Uh, well, that one, and again, I tell a couple of these stories in the book. I'd have to say the one that was the most startling was I operated on a very nice woman in her 70s who had a liver tumor, and she was a very prim and proper lady.
Mm-hmm.
And her husband was a deacon at their local church, and they were very pious people. And I did the operation successfully, and I went out and talked to the family, told them everything went well.
Mm-hmm.
And the family and I happened to show up in the recovery room at the bedside at the same time to see her about an hour after surgery.
Mm-hmm.
And when her husband said, "Honey, how are you doing?"
Mm-hmm.
she cut loose with a string of curses that was unbelievable. I
Okay.
mean, just stunned her husband and her daughters who were standing there. The anesthesia had caused a little dissociative effect, and
Uh-huh.
she just called everybody in the area every name you can imagine. And I thought her poor husband was going to have a heart attack. He was
Right.
grasping his chest, and
Right.
the daughters turned to me and said, "Is this usual?" And I said,
Right.
"No, not usual, but it does happen."
Right.
Well, of course, the next morning, the woman was mortified. She remembered none of this.
Right.
And her family, I saw her for many years after, and, the family would tease her every time I saw her, about the time Mama cussed out us and Dr.
Right.
Curley.
Right.
And it was a funny experience. All the nurses in the recovery room were amused, and
Right.
they just thought, "Wow, that was quite a demonstration." And one of the daughters said, "I didn't know Mom even knew those words." So they
Right.
found out she did.
Oh yeah. Did they ever? Okay, so Stephen, since you're into research, I'd like to ask, have you investigated other methods other than the ones that you're presently investigating? Stuff like maybe genetics or alternative medicine or things like that.
Well, alternative medicine is something I'm very interested in. I grew up in New Mexico where there was a lot of that going on, and that's actually a topic of another chapter. I have a patient who I talk about in there who is an American Indian who was doing different types of herbal treatments. And I always ask my patients, in addition to their prescription medication, are they taking any herbal remedies or other over-the-counter things they found on the internet,
Mm.
because some of those, they may or may not be helpful, but some of them actually can be harmful.
Right.
And a few of them we found actually can stimulate the immune system and maybe reduce the risk of infections after
Right.
surgery. So I'm definitely not opposed to those sorts of things. I just want to know what my patients are using so I can be
Right.
prepared.
Right.
And fortunately, I'm happy to say there is a lot of investigation going on in research labs throughout the country, and also at the National Cancer Institute, looking into these so-called alternative therapies. Definitely been interested in genetics research, in immunologic research. As you know, immunotherapies are a very hot topic right now. We've found that there's a number of new drugs that have really changed the treatment of tumors. The people who found these checkpoint inhibitors just won the Nobel Prize for Medicine and Physiology this year. So this is an important change in our understanding of the immune system. And I think you're going to continue to see that develop over the next decade. There are a number of new pathways that have been identified that I think if we can alter those, it may improve our ability to use immunotherapy to treat more cancers.
Wow.
Right now, there's a limited number of cancers that it works for, but our hope is that that's going to continue. So we are engaged in some research related to immunotherapy and trying to overcome the ability of some tumors to suppress the immune system so that we could ultimately would love to get the patient's own immune system activated to help kill the cancer cells.
Right, right. And I think that would be best. I mean, if the body's own systems overcome the cancer cells, I mean, no side effects, nothing of that sort. I mean, it's all from the patient.
Sometimes, yes, sometimes there are side effects. If the immune system gets overactive, it can
Ah,
start attacking other things.
right, right.
There's no free lunch, unfortunately, in any kind of therapy these days. But certainly those side effects tend to be less profound,
Right.
not in all patients, but that would be our hope. That's sort of a pie in the sky ideal dream is, gee, wouldn't it be great if we could come up with a treatment that would be effective, that wouldn't have a negative impact on the patient's quality of life. We're certainly not there yet. There's no such thing as a medication with no side effects, but
Yeah, yeah.
that would be ideal if we could get to that point sometime in the future.
All right. Well, definitely, what you mentioned is definitely an interesting avenue of research, and hoping that does produce positive results.
Absolutely. That's always the goal.
Yeah. Okay, so Stephen, let's say you came across someone who discovered he or she has cancer, or is a loved one of such a person who discovered, that they have cancer, and you had only time to tell that person one thing. What would be that one thing you'd tell that person?
The one thing I would tell them is to use every resource they can to get information and to not be disheartened or depressed uh, beyond to the point where they just, fall into despair. I've seen patients, as I mentioned, who maintained an upbeat and positive attitude and who either survived long term and are cancer free or who lived many years longer than we would have predicted.
Right.
The converse, I've seen patients who I thought had very treatable situations who became so depressed over the diagnosis of cancer that I literally watched them wither away in front of me and ultimately succumb.
Right.
And so that is always a very frightening thing when people kind of give up. So I tell people, to use me and others as a resource to get information,
Hmm.
to always feel free to ask questions, to learn more so that they can be actively engaged in their care and so that we're really partners in this journey. So I really tell people, to take care of the whole body.
Right.
The mental aspect, um, the aspect of not giving up, staying active, exercising, eating a healthy diet, those are all things that can really be helpful to patients when they're going through cancer treatments.
All right. Okay. Cool. So wise words right there. Anyway, about speaking of wise words, in the last minute or so of this interview, Stephen, are there any additional words of wisdom you'd like to share to inspire listeners?
Well, I think the thing that's important is to remember that, unfortunately, we cause some of the cancers that we get. So people who smoke obviously are at a higher risk for lung cancer or
Right.
head and neck cancer, oral
Right.
cancer. People, need to be more cognizant of the fact that we should exercise and eat healthy diets. As you know, obesity is a problem in this country, and
Right.
we now know that obesity increases the risk of multiple types of cancer.
Hmm.
So one thing I really always emphasize to my patients is, to a certain extent, you're in control of your destiny, how you do going forward.
Right.
Adopting a healthy lifestyle, avoiding things that we know are unhealthy, like smoking,
Hmm.
are things that people can do to help themselves and to reduce their risks of either developing cancer or having cancer returned.
Right. Right. Okay. Well, yeah. I mean, we are ultimately in command of our bodies, and through that, to our destiny.
That's absolutely right.
All right. Cool. Okay. So, thanks for those words, Stephen.
You bet, Alex. Happy to help.
Yeah, you're welcome. So, in closing, then, the book is In My Hands: Compelling Stories from a Surgeon and His Patients Fighting Cancer. The author is our guest, Dr. Stephen Curley, and you can find his book on Amazon. So, Stephen, thank you very much for being an author story. It was, for me in particular, it's very enlightening to get, doctor's point of view of cancer patient.
Well, thank you again for having me on the show, Alex. I really appreciate it, and I enjoyed the questions and the conversation.
You're welcome. So, everyone, I invite you all to check out In My Hands, and of course, please feel free to subscribe to our channel. So, I'll catch you all next time on Author Story Weekly Interviews with another interesting topic and another amazing author.